Okay, well, we'll get started officially. Good afternoon, everyone. Thanks for making time. I'm Aaron Lebo. I'm the Vice President of People, Culture, and Communications. Happy to be playing a role helping moderate today's virtual town hall on December the 7th. Thank you to everyone that could be here. A reminder, your colleagues couldn't join us live today, that this webinar, like all of our virtual town halls, will be recorded and available through the hub and distributed and dispatched today. So you can encourage your colleagues, if there's something that you hear that you think they ought to know more about, you can view the webinar offline later. Okay, a little housekeeping off of the top. We will have our Q&A function open today for questions. So all of our panelists will be answering questions as they come up. Those answers will stack up in the answered tab within the Q&A function. So we'll keep that for questions. We'll reserve our chat function for later in our agenda. We'll have an opportunity for celebrations, really important part, especially during Star Week, our Winter Star Week. So special thanks and recognition. If there's something you would like to call out today, someone you would like to celebrate, or a milestone or accomplishment you'd like to recognize, maybe you can think about that as we go through our session today. And at that moment, we'll ask people to type their celebrations in the chat function, and I'll read them out, or you can raise your hand and you can give your recognition live. So two options there. So Q&A for questions, and we'll keep the chat for our celebrations later. We've got a packed agenda today and lots to cover. Thanks to all our presenters in advance. I'll turn things over to our President and CEO, Rob McIsaac. Rob, over to you.
Thanks very much, Aaron. And good morning, everybody, and thanks for joining today's town hall. As always, I'll start by acknowledging that we're privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. A few updates for everybody. Last week, HHS welcomed our Minister, the Minister of Health and Deputy Premier Sylvia Jones, to McMaster Children's to announce the hospital's share of a number of new sector-wide pediatric investments. So these are investments that are intended to improve access to healthcare for children and youth in Ontario. And the minister was there to reiterate the government's $30 million investment in our children's hospital, part of a much larger total investment of $330 million in Ontario's pediatric health system. So it's a very exciting time for McMaster Children's and for our teams, patients, and families who are so deserving of this investment. And it ultimately is going to help us transform care for kids across the region. So we're very much in the midst of deploying those funds, hiring up staff, et cetera, et cetera. So congratulations to the Children's Hospital. Maybe you've heard, in November, HHS was named one of Hamilton Niagara's top employers. That's for the third year in a row. So this is an annual competition that recognizes Hamilton, Niagara area employers that lead their industries in offering great places to work. It's the 9th time HHS has received this recognition since the competition started back in 2008. So we are the largest employer in the Greater Hamilton region with 18,000 staff, physicians, volunteers, et cetera. Congratulations to everybody who helps to make HHS a positive place to work. I know that's been something that's been more challenging than ever before, given the shortages that folks are laboring under. But anyway, it's still nice to get that recognition, and thanks to all. So we're approaching the end of, you can tell by my background, Winter Star Week. Tomorrow is the last day of this week-long celebration of everybody who works, practices, volunteers at HHS. We've had a series of socials, star socials, used to call them holiday teas back in the day, that have been happening across all HHS sites over the past week. There's, I think, a couple still to go. These events are really a great way for everybody at HHS to gather, enjoy the company of their coworkers before the winter holidays. You can also participate in Star Week by sending an e-card to a colleague who you appreciate. And those cards and information about this whole week can be found on the hub. Human Rights Day is fast approaching on December the 10th. It is observed each year and celebrates the anniversary of the adoption of the Universal Declaration of Human Rights by the United Nations in 1948. The declaration was drafted by Canadian John Humphrey, and it proclaims the inalienable rights that everybody is entitled to, regardless of race, color, religion, gender, language, political or other opinion, national or social origin, property, birth, or other status. So very comprehensive recognition of all the things that go into allowing people to live lives with dignity. Those are rights that unfortunately remain under attack today when you look at what's happening across the world. As always, there's lots of information and resources about EDI and human rights at HHS, again, available on the hub. So having said all of that, I will turn it over to Sharon Pearson for her regular update on hospital operations. Sharon.
Great. Thank you, Rob, and good morning, everyone. I'll start my operation report as I usually do in terms of the COVID numbers. Today, there's 101 COVID patients, less than 5 in ICU, and we have 2 active outbreaks underway right now. And Dr. Mertz will update us more on COVID activity shortly. Next slide, please. A little bit about our occupancy, and I'm going to talk more about the sites in more detail, but you can see here certainly some very high occupancy numbers spread across our various sites. It has been a particularly challenging last few weeks that continue into this week as well. Our ALC numbers are at 254. We've typically been ranging anywhere between 245 and about 280 ALC patients. Next slide, please. I just wanted to drill down a little bit onto the occupancy and what is driving that. Certainly, we've seen some days of very high ED volumes and some increases in acuity in the patient populations as well. We did reach, it's a bit of an all-week high in a few areas, but certainly at the JH, we did have the highest number of patients that we've seen in our acute beds this week. It has put a Nornet strain on the site. They're significantly high admit to no beds in the 30s. As well as hallway patients. In response, we have had to move deeper into some non-traditional care areas within the site, and we continue to work on our surge plans given the volume continues to rise. We did speak to EMS this morning. They too are seeing increases in their volumes, which of course is then attributing to the arrivals at hospital. Unfortunately, the general in a similar situation, again, very high in the 30 admit to no beds as well today, but you can see some other numbers, 27 on Tuesday, but on average, a little bit lower than that in September. Again, at that site, all of the funded and unfunded physical spaces are opened as well, and certainly using our rehab areas as we can to support the acute flow. Next slide, please. Unfortunately, no site is unaffected. Certainly, we have similar pressures at the McMaster site, higher than normal occupancy numbers. We've had sustained pressures now in pediatrics for a period of time, certainly in the PICU, even though we have expanded the PICU beds with 4 additional beds, we still have high pressures and also high pressures in NICU as well. At our post-acute sites, St. Peter's, certainly at 100%. Again, that site looking to open up some shuttered spaces for additional capacity. And we have seen the volume increases reflected in visits at the UCC as well. So just a slight increase, but you can see it is moving upwards. At our community acute site, West Lincoln, again, they are not immune to the occupancy stresses that we've been feeling. Very high occupancy of 124% and admit to no beds in the 14 and 15 number as well. So very difficult for that site. We do have our post-acute sites, our satellite health facility, and the beds that we have at St. Joseph's Villa. They are routinely filled to 100% occupancy. And I mentioned the ALC and where we are right now. So it is just a slight increase that we're seeing. In terms of some of the other contributors to the pressure, certainly the outbreaks do affect our ability in some cases to admit to those units. And just like we are seeing illness and respiratory issues in our patient population, so too are our staff experiencing the same. So we have seen a slight increase in our absenteeism as well. Next slide, please. In terms of what we're doing about it, many of the things that I've mentioned to you in the past, certainly maximizing that post-acute capacity as best we can. And as I said, we are consistently at 100%, working in partnership with home and community care. Again, they are experiencing their own challenges with health human resource shortages. And certainly the outbreaks are affecting our long-term care home and retirement partners as well. Our surgical partners have and continue to maximize the same-day home opportunities wherever they can. Unfortunately, we have had to cancel surgery in the last few weeks because of the site capacity pressures. In terms of other strategies, I mentioned we're using all of the space available to us. At the JH, we are looking at the oncology day space, and we have been using that not as a day space, but as a 24-hour space, and looking for other spaces should we need those. The teams are, wherever possible, maximizing those virtual and remote care options. And certainly, wherever possible, our ED visit and admission avoidance strategies are in place and certainly supported by our ever active CAT teams and staff that we have. We are meeting regularly internally, but also with our system capacity partners. We have had corporate IMS meetings this week to talk about the state of our site, certainly. All of the efforts amidst of all this, of course, are focused on prioritizing all of our workforce planning efforts to stabilize our resources. And there are areas in the organization we are seeing some increased stability and some reduction in those vacancies. So that's a very good thing. And of course, we're always reminding the public about their options as far as healthcare, but also encouraging them for uptake with the flu and COVID vaccine. So again, lots of work underway to try to mitigate the pressures that I know you are all feeling. I would extend a sincere thanks because I know that it is very challenging to work right now, and it is extremely busy. So thank you. And I will hand it back to Aaron.
Thanks very much, Sharon. For sure, trying times. Next on our agenda, we have Dr. Dominic Mertz, who is our Medical Director of Infection Prevention and Control, to give an epidemiology update. We're in the middle of viral season. Dominic, how are things going and what do we need to know?
Yeah, thanks, Aaron. I don't necessarily have any good news, and Sharon already shared with you all the challenges we have. Nothing is out of the extraordinary or unexpected in terms of what's going on in terms of respiratory virus activity at this point. And unfortunately, flu is only starting, but I will show you some data around that. So talk about activity of respiratory virus locally, then the impact on healthcare, and then a quick reminder about masking that was in your inboxes yesterday. Next slide. So these are the figures that you're all familiar with, that you can find yourself on the Hamilton Public Health Services website, highlighted in yellow the last 4 weeks, as well as the same 4 weeks last year around the same time. This is COVID activity first in terms of number of deaths, hospitalizations, ICU admissions, and wastewater. And what you can see is we see an increase in death and hospital admissions compared to summer, but we see less activity than last year around the same time. ICU-wise, we had a hiatus last year around this time, 4 weeks, no admission. This year we had one admission roughly 4 weeks ago with a Hamiltonian. So ICU admissions remain quite rare for COVID at this point. What stands out is the wastewater at the bottom, which shows you, I would say, an estimated double the activity in terms of COVID in the community than we would have had last year around the same time. So my takeaway here is probably there's much more COVID out there in the community than we would have had at any point of time last year. However, the impact on the hospital seems to be less than it was last year around the same time with less activity. So maybe some good news here. Next slide. This shows you for Hamilton the number of patients with respiratory infections who are hospitalized. The red bars, apologies, are our COVID patients. Again, you have weeks 46 to 49 in the current year and in the past year highlighted. And I think the differences you see relatively clearly is the flu piece in particular. We see much less flu this year than we've seen around the same time last year. You may remember we had a unusual early flu season last year. RSV certainly has picked up. Those are the yellow bars, similar, not as bad or as bad yet as last year, but certainly a significant number, in particular in our children's hospital, and I will come back to that. COVID-wise, similar ballpark, maybe a little higher in total beds occupied at this point of time versus last year around the same time. Next slide. I mentioned outbreak activity, and this is a very busy slide from the Ontario Public Health website. You see the yellow curve there with a highlight around it, which is the number of outbreaks for respiratory, for COVID specifically here within the city of Hamilton. And you can see we have had less over the last 4 or 5 weeks than the year prior, which is the orange. But as Sharon mentioned, even those couple that we typically have at the given time point have a negative impact in terms of patient flow. But we aren't doing any worse. In fact, we are doing better in terms of number of outbreaks than we did last year around the same time, despite presumably more COVID activity out there in the community. Next slide. ED visits for respiratory tract infections across the board. At the top, you see for 0 to 4 and 8 to 64, it's pretty much within the margin of what's expected. It's running higher for the 5 to 17 and 65 plus population. Those are the curves at the bottom, where you see that the black line is above the 2 standard deviations, which would be the red line. Next slide. What do we see in terms of viruses? Most positive tests are for COVID, 259 from HRLMP over 1 week. Second most frequent one, and by far the most frequent one in children at this point, is RSV, still followed by rhinoenterovirus, which is still surprisingly high for as late in the season. We did peak end of September, early October, but it just keeps on continuing with some relevant activity there. Flu is only taking up speed, 76 in total, pretty much spread out over all age groups at this point. Next slide. This is a children's hospital. Red line is the total number of ARI patients. You see orange highest, that's RSV, which took over mid-October in terms of being the pathogens most frequently resulting in hospital admissions in the children's population. Back then it overtook rhinoentero, which continues to be still a strong second here. And then you see at the bottom in gray and blue some background activity with COVID-19 and flu A. Next slide. So where are we at in the season? This is US data, as you can see. You see that southern US now is in high to very high ILI activity. So this is respiratory infections across the board type of activity. But the north is still minimal to low. We might be in moderate locally, but it basically means more is to come, most likely. Next slide. And this is how it looked like same period of time last year, around November 26, a lot of purple and dark red. So we are lagging behind, and that's why I said there's most likely more to come, and we are not over this hoop yet. Next slide. So where we are today compared to last year around the same time, COVID activity is presumably high in the community based on wastewater data, similarly low ICU admissions, and we see less hospital admissions, outbreaks, and COVID-associated deaths due or from COVID. RSV is the leading pathogen in the pediatric population, followed by rhinoenterovirus, and the influenza season has just started. And just to put the block in, it's not too late yet to get the flu vaccine if you haven't yet. And then the quick reminder that was communicated yesterday, we continue to limit masking requirement to clinical areas for healthcare workers, which is where we expect most impact, in particular in terms of prevention of outbreaks. So please continue to do so. And with that, handing over back to you, Aaron. Thank you very much.
Yeah, thanks very much, Dominic. Always insightful. Thank you very much for the update. Okay, next up, some information about our EPIC feedback survey from Dr. Rob Lloyd, who's our Chief Medical Information Officer. Rob, what do we need to know?
Hi, Aaron. Thanks. Thanks everybody for tuning in today. I want to talk about the feedback survey. We are now 18 months, almost to the day, post EPIC go live. Everybody, it's part of your everyday lives now, and we do get feedback from you through specific requests, through hallway conversations, and through the data gathering that we try and do in the system. But it's time for us to do a really formal feedback. We really need a broad set of feedback from you to continue to improve this system. The team's been very busy for the past 18 months, continuously improving. Lots and lots of work going on, and I will take a moment to remind you that we've got a major upgrade happening tonight. We're doing a version upgrade. We've been planning for this one for about 6 months. Reminder that we have a downtime starting at 12:30. We've got 2 hours identified for it. It probably won't take that long, but a reminder to your clinical teams to be ready for it. But we really want to get some feedback on how it's going. And so next slide, please. We've been working for a number of months on a survey that is actually a North American survey, a standardized survey that large enterprise systems use to get feedback on how EHRs are going. All of our colleagues in Ontario are going to be administering the same survey so we can compare results. We put a fair amount of energy into getting the questions right. And so we will really ask you to take the time over the next 6 weeks to fill out this survey. You're going to be seeing a link and a QR code, which will be coming by email and by communication from comms. We're encouraging all clinical staff to participate. And this is a list of those that are considered clinical, the ones that we're looking for feedback from. So all providers, all physicians of all types, and midwives, nurse practitioners, PAs, residents, all nurses of all classifications, all allied health professionals. This includes business clerks, pharmacists, and some lab technicians and technologists. It takes about 10 to 12 minutes to fill out. It's not just a couple of minutes. It takes a little bit of a commitment, but we are looking for your energy to help us out. Next slide, please. So the system is only as good as you make it. You've helped us get us this far. Please give us your feedback. Let us know how it's going. Fill out the survey as you head into the holidays and encourage your colleagues to do the same. That's it for me, Aaron. Thank you.
Okay, thanks, Rob. Yeah, really important effort and an opportunity for everyone to give input. It's great that we're at this point where we're able to do that survey. So thanks very much for sharing that today. Next up, as many of you know, we've been working through our workforce planning initiative with a view to stabilizing areas that are experiencing instability due to staffing. Part of that included being thoughtful about aggressive recruitment marketing we could undertake as an organization. And to give an update on that work is Kaylin Pettit, our Director of Communications and Marketing. Kaylin, what do we need to know?
Thanks, Aaron. So I wanted to start out by saying that this work is the result of really great collaboration between the communications and talent management teams. So just a quick shout out to everyone who has contributed to this work. So as Aaron mentioned, this is part of a broader workforce planning initiative, which is part of our strategic plan at HHS. And it's really focused on attracting more people to our organization, again, looking at those areas where there's greatest need across the organization. And so what we've done is we've launched a large-scale national recruitment marketing campaign across all provinces. And this is running over the next several months and includes a custom package with Indeed, which I'm sure all of you know is an online job posting website. It's the largest job posting website. And we've worked with Indeed to create a custom package to highlight priority roles and job postings at HHS and increase our overall organizational profile on that site. So it seems like a very specific tactic, and it is, but it has in past and will continue hopefully to net us a really great return in terms of the number of people who are seeing and ultimately applying through job postings at the hospital. We've also launched a paid national paid social media campaign. So you may have already seen some of the posts and creative in flight. This is a really exciting part of the campaign because it features a few employees and colleagues across the organization, and I'll show you a glimpse of the creative in a moment. We've also done a lot of work to refresh the HHS careers page on our website and the hospital's presence overall on other key job platforms. So we'll be looking really closely at campaign performance in the coming weeks and months. I'm happy to say that after just about 2 weeks of launch, we're starting to see some really early positive return in terms of the number of people who are not only seeing the campaign and engaging with it online, but who are actually navigating to our website and applying through to us. So we're really, really optimistic that this is going to help our overall recruitment efforts at HHS. Next slide, please. So some of you might recognize some of the faces on the screen. So we, so far, for the first few months of the campaign, have featured 3 colleagues from across the organization. And the campaign is really centered around the idea that HHS is an organization where you can not only begin, but grow and spend your entire career. I think there are many of us here who have started in one role and have progressed or moved to other roles across the organization. And so we're really trying to highlight the fact that the breadth and scope and diversity of the organization is very vast, and therefore that it's an excellent destination for those who are looking to really grow and build a career. So the campaign is titled Imagine, and the tagline is The Career That You Imagine Here. There are a number of videos that we've created and other pieces of collateral highlighting our colleagues here. The videos in particular are really fantastic. So I will paste a link to that in the chat so that if you haven't had a chance to see them, you can go and watch on your own time. Next slide, please. So finally, an ask to you, all of our colleagues across the organization, is that you help spread the word about the campaign and about life and work at HHS overall. So there are many ways that you can help out and support. So you can visit HHS on social media and share the campaign posts through your own channels. As always, talk to your colleagues outside of HHS, your friends, your family, people within your network, and let them know about the opportunities here. Of course, you can direct folks to our careers website if they're looking to see what is available in terms of opportunities. And we also have, if you're not familiar, we do have a staff social media Facebook account for HHS staff on Facebook, and a Twitter or X account as well. And we really encourage you to share your experience working at HHS, share and celebrate your teams and the things that you're doing. You can use the hashtag MyHHS. We're always looking for folks to engage online so that we can amplify your posts and further share with our broader network and community all of the great things that are happening here. And as always, you can visit the Hub for more information about the campaign. And that's it for me. Thanks. Back to you, Aaron.
Yeah, thanks very much for that, Kaylin. So just a reminder to everyone that we do have our Q&A function open, and it'll remain open until the end of today's town hall. So you can ask questions and they'll be answered in that forum. And if there's something that comes to mind that you wanted to ask, but you didn't today, you can always email questions as well as suggestions about this format and this town hall to hhsnews@hhsc.ca. So an opportunity there. And next on our agenda, we have the opportunity for celebrations. So I'm hopeful that some of you have thought about that throughout the course of today's town hall, and you have something that you'd like to remark upon. Rob, quick on the draw with a hand up. What would you like to celebrate today?
Yeah, thanks, Aaron. We got a letter from a patient's family this week, which I thought I would share some excerpts from, because I think it's so meaningful about the work that we're doing. So let me just read a couple of excerpts from the letter, which I'm paraphrasing a little bit, but this family member says, the doctors, and particularly the nurses, never made our mom feel anything but important and tried their absolute best without stopping to take a breath for themselves. They were so pleasant and positive. All staff were always moving, always taking care of patients, but more importantly, always smiling and very happy to give kind, positive words to patients and family. We were so completely impressed with the entire staff at the hospital. The amount of patients seen and cared for on a daily basis is staggering, and yet your staff makes it look effortless, like a well-oiled machine. We have not seen that kind of compassion or care for many years. Hats off to the entire hospital staff at Hamilton General Hospital. So congratulations to everybody at the General for evoking that thank you letter. And I know that similar letters could be, and in fact are written about all of our sites, but I wanted to share that today from a patient's family that we just received and I thought was so compelling. So a shout out to the General, but of course all of our staff.
Great, thank you very much, Rob. Any other, our panelists or from our viewing audience today? If you raise a hand, we'll call on you to give your shout out. Sharon, I see you with a hand up. What would you like to celebrate today?
Thanks, Aaron. In Rob's opening remarks, he referenced the visit from Minister Jones in response to the infusion of significant resource to grow McMaster Children's Hospital. And so just that amount is close to $50 million investment in the hospital, but it also involves over 25 different initiatives and the hiring of over 300 staff and also physician recruitment. And I just wanted to give a shout out to the team, Bruce Squires, Dr. Angelo, Mike Janakis, and the team, Colleen Fotheringham, that are leading all of the work. There's much work to do to actually put that money to great and valuable use. So many thanks to the teams from inpatient, outpatient, perioperative for all the work they're doing in response. So thanks.
Sharon. Susan, I see you in the hand up today. What would you like to celebrate?
Hi, thanks. Oh, sorry, can you hear me okay?
Yep, we got ya.
Great, thank you. So in addition to Rob acknowledging the Hamilton Niagara Top Employer Award, just wanted to let everybody know that this past week we were also advised that we have been awarded the Canada's Healthy Workplace Month for Great Employers Award for 2023. That's from Excellence Canada. That award recognizes organizations that are committed to providing a healthy and safe workplace. So that was a huge achievement. And separately from that, I just wanted to acknowledge the health, safety, and wellness team who has been working diligently over this last 12 months and has just received recognition from the Workplace Safety and Insurance Board in completing the 4 projects for the Health and Safety Excellence Program. Again, that demonstrates the commitment that we have to creating a safe environment for all of our staff physically and psychologically. So great work to all. Thank you.
Appreciate that. Thanks, Susan. I'll just read out a few in our chat forum today from Morgan Richardson under the leadership of Pam Westover, Danielle Petruccelli, Dr. Tammy Packer. Very thankful to sit amongst some credible SMEs on our Seniors Council, aiming to identify seniors friendly practices throughout the organization. Thank you, Meg Chalmers, for her presentation today. The transformative influence of friendly visitor volunteers on seniors' healthcare, highlighting the incredible impact our volunteers have on our senior population. And on a separate note, thanking Angie Ratzlaff-Lane for her efforts in bringing forth Project Search to the Hamilton General Hospital and Ron Joyce Children's Health Center sites, which is a school-to-work transition program for young people with intellectual or communication disabilities that takes place entirely at the workplace, thanking our internal stakeholders that were excited to engage these youth in fantastic opportunities. Thanks, Morgan, for that shout out. Really great stuff. Great work underway. From Deb Bedini, thanks for sharing the letter from the family. Rob, thank you to the Hamilton General Hospital staff for the excellent care they provide. From Kristen Lishkiavo, a big shout out to the teams who make the holiday magic happen at our McMaster Children's Hospital. For our patients and families, their efforts go above and beyond to ensure a memorable and festive experience for everyone. It is truly remarkable. From Leslie Gillies, noting thank you for the Star Week teas, appreciated by all at each site. From Liz Ferez, celebrating McMaster's 4th annual critical care update yesterday. Lots of attendees and speakers from HHS. It was nice to see so much interest and a return to in-person conferences. That is great too. From Kim Young, amazing to receive the patient letter. Congratulations to the Hamilton General Hospital teams and everyone working to meet the needs of the individuals we serve. From Alexis Taylor, the Juravinski operating room is back up to pre-COVID volumes with an additional 3 blocks per month. It's been a long road with pandemic measures and health human resource challenges. We're very happy to be at full volume in order to care for the most patients we can. From Erica Casperson, congratulations to our 19 HHS new peer supporters available to provide support to staff and physicians through our new Beyond Silence mental health app. Check that out if you have not already. From Diana Marinescu, thank you, a huge thank you to the peri-op team at Juravinski Hospital for their hard work to limit surgical cancellations over the last few weeks. Big thank you to the post-acute care unit for working so hard to support the needs of surgical patients as well as at the site. Lastly, thank you to the Juravinski Hospital peri-op directors for their support to ensure our teams and patients are advocates for. That is great. From Catherine Duffin, thank you to our wellness team for supporting staff recognition. From Georgia Georgiou, kudos to the gynae brachytherapy team and the cross-functional team that will be ramping up to 2 days per week in December so that we can serve more patients closer to home. That's a stellar raft of celebrations today. I'm sure in part because of Star Week, but also because of all the amazing work happening across our organization. Don't see any more coming in, but I'll leave it there. Rob, over to you for final remarks.
Thank you, Aaron, and good job as always. So thanks all for joining today. I hope that, whatever it is that you celebrate, each of you have an opportunity to enjoy the holidays with your loved ones in the coming weeks. As always, special thanks to those who'll be working on the staff holidays over December to ensure that our patients and families are well cared for. Thank you all for all that you've given to HHS this past year. For sure, another challenging year for the health sector, but I think we've achieved so much and helped so many despite the challenges that we're laboring under. So happy holidays, Merry Christmas, and I'll look forward to the next town hall in the new year. Cheers, everybody.